Thank you for staying with us on Channels Television. Welcome to Health News. I'm Yomi Otaigbe. Today, our focus on the program is on Nigeria's National Tobacco Control Bill, which was passed by both the Senate and House of Representatives in 2011, but yet to be signed into law. We'll be looking at the importance of this bill and why it needs to become law in the interest of public health. I'll be back in a moment. Regular medical checkup is one of the key factors in achieving a healthy life. This was the message passed by the Lagos University Teaching Hospital at a free medical screening program by the hospital at Idiaraba here in Lagos, Southwest Nigeria. These and other stories for you right now. The free health screening for residents of Idiaraba in Lagos, organized by the Lagos University Teaching Hospital as part of the hospital's 50th anniversary celebration, include medical checks for the eyes, blood pressure, body mass index, and a host of others. The chairman, Medical Advisory Committee of LUTH, Professor Lugbemiga Ogunlewe, advised everyone to put premium on their health by ensuring that regular medical screening is top on their priority list.
We have seen some cases of cataracts, patients who have cataract. In fact, we have seen somebody with a very high blood pressure that we have to take to accident and emergency to attend to. We have seen people with high cholesterol level. We are also doing some tests for HIV. We are screening for HIV. Some of them, we've seen some, we refer them to our APIN center. As you know, LUTH is celebrating its 50th anniversary this year, and we feel we should give back to the community. Since we are located within two communities, Idiaraba and Mushin. And also, we feel that most of the people around here cannot come to LUTH for one service or the other, mainly because LUTH is a referral center, it's a tertiary health institution. And we know that in management of any of the diseases, we always say prevention is a better cure. So we feel we should come to the community, identify some of them that have some of these health challenges, and then we can see how we can help them.
Now to issues surrounding the National Health Bill. The Pharmaceutical Society of Nigeria, Lagos State Chapter, has called for a redrafting of the National Health Bill to include all stakeholders in the medical field. Addressing journalists at a press briefing, the state chairman of the society, Mr. Kintude Obembe, alleged that some sections of the bill is capable of causing conflict with other existing healthcare regulatory acts in the country.
The federal government is doing something to correct the many anomalies in the National Health Bill and indeed the National Health Insurance Scheme. The truth of the matter is, if we do not do it right, we can never get it right. The pharmaceutical sector is ready to contribute its quota as expected in the overall interest of a vibrant and progressive health sector. We also want the federal government to implement without delay the report of the committee set up to ensure harmony in the health sector.
Moving on to other African countries, a cholera outbreak in West Africa has killed at least 250 people since the beginning of the year. Médecins Sans Frontières, an international medical agency, says the disease has been spreading through Guinea and Sierra Leone, where most people live in slums and urban areas. Hygiene and sanitation are a major problem. With over 10,000 cases reported in Sierra Leone alone, the World Health Organization has described the situation as critical, and this confirmed by Fatmata Kagbo, a nurse at a cholera treatment center.
They are crying of cramps, their feet, even their hands, they are cramping. They are falling down, they got dizziness. Some of them say, I want to die, I'm tired of this disease. So at the end of the day, some of them die.
According to MSF, cholera is endemic in both Sierra Leone and Guinea, and there are sporadic outbreaks in both countries. But since the last major outbreak in 2007, people have gradually lost their immunity. Some of those infected say poor sanitation in public areas is to blame for the outbreak.
There might be many causes, but I think one of the causes is the field within the city, especially in the marketplaces.
The acute intestinal infection, often linked to contaminated drinking water or food, causes severe diarrhea and vomiting, leaving young children especially vulnerable to death from dehydration. Malnourished children are most at risk. Aid agencies say that with proper treatment,
fewer than 1% of cholera patients should die.
It is always good that a better health promotion activity is put in place to increase the knowledge of the people, because when they are properly informed as to how they could practice personal hygiene, environmental sanitation, it minimizes the rate of cholera transmission.
The WHO says every year there are an estimated 3 to 5 million cholera cases worldwide and 100,000 to 120,000 deaths from the disease, whose short incubation period of 2 hours to 5 days enhances the potentially explosive pattern of outbreaks. Smokers and non-smokers alike have given a cautious welcome to the news that Australia's planned tough anti-tobacco marketing laws will come into effect later this year. A decision by Australia's High Court dismissing a legal challenge from cigarette companies means all tobacco products will be sold in plain olive green packets without branding from December 1st. The plain packages will also carry graphic health warnings. Most people questioned on the streets of Sydney, smokers and non-smokers alike, agree that the marketing law is good news in principle.
I think it's actually good news. If it does cut down on smoking, why not? It's not affecting anybody. Depends how much, I guess, if they increase the tax to pay for the packaging. It's a bit of an issue, isn't it?
Well, it is a good idea, to stop people from smoking too much. But it's just that, can we really stop? That's another question.
There's not much of a difference, to be honest. At the end of the day, they're still selling the cigarettes. So, for an image point of view, it's not really a big difference to me. So,
might discourage people. But then the question is, people who are addicted to smoking, are they really addicted to the packaging of the cigarette or the cigarette itself? So I don't know how much of a difference it's going to make, the plain packaging.
Tobacco giants British American Tobacco, Britain's Imperial Tobacco, Philip Morris and Japan Tobacco challenged the laws in Australia's High Court, claiming the rules were unconstitutional because they effectively extinguished their intellectual property rights. The laws are in line with the World Health Organization's recommendations and are being watched closely by Britain, Norway, New Zealand, Canada and India, who are considering similar measures to help fight smoking. Meanwhile, Argentina and Venezuela have started grappling with their own anti-smoking legislation days after Australia solidified a tough measure banning logos on cigarette packs. Argentina's lower house is discussing issues around passing a similar ban to deepen their anti-smoking measures. The proposal has the support of representatives and must make its way through several commissions and to the Senate. If it passes, Argentina would be the first Latin American country to emulate Australia. Smoking rates in Argentina, and particularly in the capital Buenos Aires, are high and cigarettes are cheap, sheltered from the rampant inflation affecting other products. A 2006 ban in smoking in public buildings in Buenos Aires opened the door for more legislation. And if Argentina follows in Australia's footsteps, cigarettes and tobacco products will be sold in plain packets with graphic health warnings, such as pictures of mouth cancer and other smoking-related illnesses. Venezuela also has the images on their cigarette packs, although some residents say a simple health warning could be used instead of sometimes shocking pictures.
The number of cigarettes sold in Africa is said to have increased by 6% over the past 4 years, from 384 billion in 2007 to 408 billion sticks in 2011, and Nigeria is one of the largest markets for tobacco products in Africa. Because Nigerians are not immune against tobacco-related health problems such as lung cancer, the anti-tobacco communities are at the forefront of ensuring a smoke-free public place. A member of that community, who is of the Environmental Rights Action, Mr. Femi Akimbode, said this can only be guaranteed when the National Tobacco Control Bill is signed into law in Nigeria.
Well, the National Tobacco Control Bill it's a combination of several efforts. First is the Framework Convention on Tobacco Control, which was passed in 2004, and as of today, it has about 190 signatories. The FCTC is a global framework for tobacco control. It's specifically ask governments at national, sub-regional levels to take measures to reduce tobacco consumption. Those measures are advertising ban, expansion of smoke-free public places, provisions around packaging and labeling. There are also issues of taxation. And generally, that treaty, which is the first public health treaty, has provision about alternative to tobacco growing. Now, I must tell you this, that the FCTC was initiated by the WHO. And since we have all those signatories, as is the practice in all international laws, you have to domesticate. So Nigeria signed this treaty, and Nigeria ratified by the year 2005. So it became expedient, on the Nigerian government to domesticate the FCTC. Now, we waited for the government to do that by way of an executive bill, which is supposed to be the normal practice. The executive ratified this treaty, and then when the executive was not forthcoming, we as civil society, we supported a private membership bill that was done by former Senator Olorunniyi Mamura, which essentially is to domesticate the FCTC. So what we call the National Tobacco Control Bill is an attempt to assist the Nigerian government to fulfill its international obligation to the Framework Convention on Tobacco Control. And what do you have in the National Tobacco Control Bill? A ban of tobacco advertisement, sponsorship and promotion, expansion of public smoking, ban of smoking in public places. In that bill, it recommends 50% pictograms on cigarette packs. It prohibits the sale of cigarettes to minors and by minors, because there are differences between sale to minors and minors also selling cigarettes. And essentially a few other provisions. It tries to create a committee that is called the National Tobacco Control Committee, which will be the guiding advisory committee for tobacco control programming in Nigeria. And that bill was, as our law requires, passed by the House of Rep. It was by the Senate first, and then later concurred to by the House of Rep, and was sent to Mr. President for assent. And that's why we are since last year, and it's over a year that that bill has been sent to Mr. President. We have not heard word from the presidency, despite a constitutional requirement that says that if the president is not going to sign a bill, he must send that bill back to Parliament with his reasons why he's not signing. What I would like to say is that I think it's time for the president to come out and make his position known about this bill. We've gotten bills sent to the president, and you like to say, oh, okay, this bill is not the way I want it to be. Can you make this adjustment or that adjustment? And that is taken back to Parliament, and that adjustment is made, and then we have a perfect law. Although there is no perfect law anyway. But for the president to sit on this bill forever is not acceptable. You see, we're in a war today.
So why do you think it's not been signed into law?
Now, honestly, I cannot tell you why it's not been signed. We know that there are pressures by the tobacco industry. We know that there is, communication problem between diverse ministries of government over territorial control, over, this bill is supposed to be resident in this ministry or that ministry. I think that the most appropriate thing to do at this point is for the presidency to ensure that all those issues are ironed out between all those parastatals and agencies of government or ministry, wherever those communication issues are. Because, as I was saying, Nigeria cannot afford not to have a tobacco control bill.
Why?
Look, see, it's very simple. Tobacco is a killer. That's no longer a debate. Tobacco is a product that kills over 6 million people every year. All right? And even if you use the most conservative estimates about our population, let's say we're even putting the rate of smoker in Nigeria at 10%, that means that about 16 million Nigerians are smokers. And if what scientists are telling us is true, and which is true, that half of smokers are likely going to die of tobacco-related diseases, that means we have close to 6 million Nigerians on the death row as a result of their smoking habits. That is not what a government will close its eyes and not do anything about. So it's a critical issue. Government around the world are taking measures to ensure that there is drastic reduction in smoking prevalence, and we expect the Nigerian government to do exactly the same.
Some time ago in Abuja, the policy came out that, okay, non-smoking areas in public places. How far with that?
In the year 2008, the then Minister for the FCT, Dr. Human Madibo, on June 1st, 2008 precisely, declared the enforcement of smoke-free policy, a law in Abuja. And that's essentially drawing strength from the Tobacco Smoking Act 2005, which was an offshoot of Decree 20 done under Olikoye regime. And that basically is saying that, look, this law is in existence, we're going to begin to enforce it. You cannot smoke in public places, you cannot smoke in stadiums, you cannot smoke in schools, you cannot smoke in enclosed areas in Abuja. And that is the strength of what he has done. And we're beginning to look at other states, because Earth is on concurrent list under our constitution. It's basically showing others that, look, you can move and do this to protect your citizens. Take, for instance, the Lagos state is trying to show some, ideas about good governance, responsible governance, accountable governance. Health is a primary issue that the states cannot allow to degenerate. There was a survey that was done in Lagos state where it was recorded that about 2 persons die every day in 11 hospitals alone as a result of their smoking practices. So you can't fold your arms and say, look, I've gotten the data. You're supposed to get the data and use it for appropriate policy. Good. And the new traffic law, they are saying now it's illegal for you to even smoke at all in traffic. But we're saying the Lagos state government also, because it's under their ambit to legislate on health, to enforce health issues, can also move a step forward and expand the smoke-free laws in the state. As an example, if the federal government is delaying, Lagos state they have that constitutional backing to move. And we are saying that also for several other states in Nigeria. And there are, surveys and researches have shown that, look, people who are in the same environment with, smokers, some call them environmental smoke, some call them second-hand smoke, that, look, they have almost the same risk as smokers. So, look, if it is then our responsibility to protect the rights of people who have chosen to protect their health by not smoking.
Okay, and now let's look at countries. Last week, court in Australia legislated that there should be plain packaging of tobacco products. What do you think Nigeria can learn from that?
You see, the significance of that High Court judgment in Australia is this. Whenever any government or any country tries to legislate on tobacco control, the tobacco companies will do 2 things. They will try to bully, then they will try to do legislation. They bully by telling you that, look, you can't do this. We are a big company. We are paying taxes. We are generating employment. We are contributing to the economy. You understand? The economic argument is completely faulty. But then they can also go to litigation. They sue the government to say, look, you cannot take our commercial rights. And they've done that in Philippines, they've done that in Australia, they've done that in South Africa, they have a suit in Uruguay, essentially trying to litigate their way out of regulation. What the Australian court has told us, and just also this year, South African court, is that in any time, at any point of our humanity, that there is a conflict between health and the commercial interest of tobacco companies, the public health must take precedence. What was the issue? The Australian government, put in place a law which says, henceforth you have plain packaging. What is plain packaging? No more branding, no more color coding, no more trademarks. Your cigarettes will be in plain olive green, and then you have the pictorials of what it can cost, because Researchers have also shown that the packaging and the colorful things that they associated with cigarette has been one of those that they used to addict our youth and our children. And they say, no, our colors and all that are proprietary rights. So the government wants to steal our proprietary rights. They want to steal our trademarks. We have to put our trademarks on our cigarettes. And then the court has ruled. Let me tell you this. Immediately after that court ruling, the South African government issues a statement that they are going to follow suit with that plain packaging law. The UK government say they are studying it with a view to applying that. The Philippine government, in Philippines, the government said, look, we are watching this towards enacting. So you see a movement across the world to ensure that they put the best and the maximum available standards to protect their citizens. What do we have in the National Tobacco Control Bill? We are basically recommending 50% pictograms. We're just not there yet. We are still far away from it. So when you compare what is happening at the global level with what we have now, you see that we are far, far away and that the Nigerian government needs to move very, very fast.
Okay, and is it just about the government? What about individuals? Because you use your own money to buy this.
Now, in all this, there is what is called a national policy on tobacco control. The government is there to protect us, the weak, from the mighty, the tobacco companies, because they have the adverts, they have all their chains, they have these distribution networks, they do all sorts of things. And don't forget when they were doing loud in Lagos, wide in Kano, and the numerous umbrellas that you have all around Nigeria that they are trying to use. Promos. They do promos asking our kids to smoke and get camera or iPhone or iPod or all those kind of stuff. So you need a government policy that will reduce their influence on our people. You need a policy that will reduce the environment that encourage our people to smoke. That's where the government comes in. And where are those environments? You look at the price of cigarettes in Nigeria today, 200. Why is it 200 naira and it is 1,500 when you look at the same price, same product in UK? So who is subsidizing what? So when you price cigarette appropriately, now you've reduced the number of youths and our kids that will have access to cigarettes. When you say you can't smoke in school and you enforce it, and you say you can't also sell in schools, you've reduced that environment that makes it so easy for that kid or that child to walk to the kiosk and buy cigarettes. So you have to look at that totality in terms of government helping to put in place policies and legislation that will change the lifestyles of the people.
But that will still not stop some people from doing that.
Now, we are basically saying reduction. You will reduce the number of people that are smoking. And we are very particular about exposure of our youth and our children. Those are areas that we're very much interested. Cutting those new recruits, okay, because every time tobacco smokers are dying, so they need to recruit the youth to replace those ones. So we're saying, look, let's cut off that chain of recruiting new people into smoking, and then gradually we'll be able to tackle this problem.
Okay, you don't think more should be in the area of awareness on the health, implications of smoking?
Absolutely. When you talk about the packaging, which I spoke about, it has to do with the messages that we are putting on the cigarette packs. It's part of education, public education. The Ministry of Health, civil society groups, all of us have to work together to ensure that people know the real dangers of smoking.
Thank you so much for speaking with us on Healthnews. According to the World Health Organization, tobacco kills up to half of its users. While we wait for the National Tobacco Control Bill to be signed into law, a law that would protect Nigerians, especially non-smokers, from the consequences of passive smoking. Make the right choice by not smoking, especially in public places. That's how we wrap up Health News for this week. Do send your question or comments to healthnews@channelstv.com or to the number and Twitter handle showing on your screen. Thanks for being with us. I am Yomi Otaigbe.